They opted for C. Then second team is Manav Khatri and Nayan Pandey from AIIMS Bhopal. You have also option of remaining seats to choose. Third team is from Mahatma Vijur Autonomous State Medical College, Bijnor, UP, Maan Tyagi and Amrita Jain. Please choose the remaining seats, whatever you prefer, A, B, and E. I think they have opted for B. So team B is from Mahatma Vijur Autonomous State Medical College. Then fourth team to qualify is Garvit Gupta and Vicky Chao, AIIMS Raebareli. Please do the green hand. You can choose. So they opted for E. Gaurav? Okay. Then last team to qualify is from GMCH Chandigarh, Hargunveer Saini and Manvir Singh Lailar. That's all the way from Chandigarh. If they can get. So before that, I will ask you to please give a big round of applause to our learning secretary who has taken all the effort for this quiz. This is our sixth edition, and each year is taking a lot of effort. Nearly 150, 150 teams qualify out for this competition, and now five teams are being qualified. So give a big hand to Dr. Sandeep Munke. All the teams, please continue, leave the rules and everything. You'll be prepared, be calm, and be focused. I wish you all the best. Instructions for all of you. I request you all to maintain transcript silence throughout the session. Please keep your mobile phones in the silent mode, and you're supposed to use it only for the audience phone. Ensure that you have proper internet connection. No ans- Please don't answer any phone calls during the session. Avoid distractions by moving within and out of the phone. And more discussions regarding the questions is permitted during any rounds. And no prompting of police officer allowed. This general instructions will take you to the overview of this program. You'll be having 7 rounds. The first round will be three, followed by recent advances. Then the calculation round, followed by that in the organism round, then clinical cases and transcription. And the points for almost all the rounds is 20 points each, except for the rapid fire, which is 8 points. 9 seconds is 20 seconds for all the rounds, except for the calculation, which will be 2 minutes. And for rapid fire round will be 9 seconds. Our scorers are Dr. Gaurav and Dr. So we total 7 rounds. There is no negative markings. Negative markings are only there for the rapid fire round, -2 for every round answer. And the time limit, as I've already told you, is 30 seconds for all the rounds except for the calculation, which is 8 minutes. There are specific minutes for each round that will be explained by the quiz master at the beginning of that particular round. No multiple guesses will be allowed. Only the first answer that is coming out of you will be accepted as final, and it should be loud and clear. The decision of the quiz master and the grandmaster of the Sandeep sir, along with the jury, will be the final and finally the overall. These are the general instructions. Can now proceed to the round one. Take to all the participants that don't look this quiz mainly as a competition. See it as a celebration of knowledge. A chance to challenge your understanding and to explore the brilliance of the those who have come before us and to feel connected with the every spirit of the scientific inquiry. Okay, so wishing you all the best to all the teams. So shall we start now? I audible from here. As you know, as you know, that the first round will be of history. So let us get familiar with the rules. So let us get familiar with the rules of the first round of history. Now, eminent scientist picture will be displayed on this board. Okay, and you will have to identify the picture, the scientist name. Okay, the time limit is 30 seconds. Within 30 seconds, you have to identify the scientist name. Okay, if you are able to identify that scientist name, 10 points will be awarded to you. Okay, and if not, then a clue will be given to you to identify that scientist. If you are able to identify the scientist name on the basis of clue, then only 5 points will be awarded to you. Okay. And if you are unable to identify that picture, even on the basis of clue, no marks will be awarded to you. Now, irrespective whether you are able to identify the scientist name or not, ultimately the scientist name is going to be revealed to you, and some question is going to be asked on the basis of the contribution of the fact that is referring to that scientist only. Okay. Now, the team that answered correctly, okay, 10 marks will be awarded to that team, particular team, but we expect full answer from that team. Incomplete answer will not be entered. Okay, and no marks will be awarded. If if the answer is uncompleted, no marks will be awarded. Is that clear? So there is no negative marking in this round. And secondly, there is no passing judgment allowed. Is that clear? All the teams, the rules are clear. Okay. So let us begin the first round. So we will be starting from team A. Is that clear? Please see the picture which is coming to the team within a matter of time. Time limit is 30 seconds. So we would like to have a clue. We would like to have a clue. Okay. The clue is that the world first heart transplant was performed by the scientist. Again, there is a limit of 30 seconds. We don't know that. Okay. No problem. So for this question, no marks is being awarded to the team. Okay. Now we are going to moving on to the second subset of question with the reference to the scientist. Okay. The name of the scientist was definitely Vernon. Okay. Now another question is that in the person who has undergone the heart transplantation, there is no cardiac intervention. People in response to exercise, cardiac output is increased. What is the main mechanism for it? Rectified. You can start now. So when we exercise, the preload for the heart increases, and that in turn increases the cardiac output. So you don't really innovate into that. Because when you preload increases uh, the myocardial size of the heart is stretched, and in response to that stretch, the cardiac, the force of contraction increases due to cardiac output. I don't think this is the correct answer. Because okay. So 10 marks has been given for the second part. Okay. So you can see that after the surgery, if the exercise is being done by a concerned person, there is an increased sympathetic activation which lead to the adrenomedullary stimulation, leading to epinephrine and non-epinephrine release through blood that bind to the V1 adrenaline receptor that increases the heart rate as well as the contractility of the heart, which in turn increase the stroke volume and the heart rate, which in turn increases the venous return and further increases the stroke volume while the frank is turning low, thereby increases the cardiac output. Okay. Now there are certain interesting facts related to the scientist that on 3rd December 1967, he performed the first heart transplantation from human to human. The transplantation was done in the Cape Town in South Africa. Okay. This patient retained full consciousness. However, the patient died after 18 days. Okay. Now, with reference to this scientist, he pursued in the cardiac surgery because his younger brother died of rheumatic fever at a very early age that prompted him to take the cardiac surgery. Now he performed a second heart transplant at the beginning of the 1968 and that patient survived for almost 1.5 years. Now we are so proud to announce and to inform that AIMS Bhopal CTVS department under the guidance of our executive director has performed the first successful heart transplantation on 25th January 2025. The patient is still alive as of today. This is clap for that. That is a milestone for Prince of Bhopal. Now for second team B. Okay, are you ready? So time start now. You have to identify this picture name. Read light on you floor. The scientist is concerned with the effect causing shift of oxygen hemoglobin deassociation to. You know the full name? No. नील बहुत फिर उसका बेटा था You will give me 5 marks. 5 marks. It's important the full name of the scientist. Okay. Now another set of questions with reference to the scientist. Name any two factors which increases the Q3 by phosphorus lactate concentration. Any two. Sir, during exercise and high altitude. Yeah, very good. Full marks. Okay. Now team C. Team C. Okay, are you ready, team C? So please. He was a German researcher who had received Nobel Prize for the cardiac catheterization techniques. You don't have the answer. You don't find the name of the scientist is Warner Theodore Otto Forstmann. Okay. Now another question is the reference with the scientist. What is Fick principle in the time that used in indicator division method? Well, the Fick's principle is that the amount of substance uptake by the any organ is given by the arteriovenous difference of the concentration of that substance multiplied by the flow rate through the organ. This is the Fick's principle. Right. Events flow. Any number related to events flow? P 1874. Full marks will be allotted to this one. Some interesting facts related to the scientist. Okay, in 1929, he put himself under local anesthesia and inserted a catheter which was 65 centimeters into the brain of his arm. And he rushed to the X-ray department just to find it out whether the tip of the catheter has been inserted properly into the right atrium or not. ठीक है ना इसके लिए he was mocked and dismissed from the department. ठीक है ना ये उसने किया था when did he did in 1929. This experiment was conducted by the gentleman on 1929, but he received Nobel Prize for his work in 1956. This experiment were done almost more than 9 times on himself, and at that time, his experimentation was considered to be the main tricks. One of the children of Forstmann was Wolf Forstmann, who was the first to isolate the arterial nephrotic factor. Now, team D, okay? Okay, so we are giving you the clue. This gentleman has described one of the disease associated with increased level of glucocorticoids. Question. Okay, we will be moving to the next question. The full name is Harvey William Cushing. Okay. Now the second question is, what is Cushing reflex defect mechanism? the Cushing's reflex is last stage reflex or CNS stimulus. In response to severely decreased blood pressure, the vasomotor system activates because of hypoxia, and that increases the heart rate and BP towards normal. What is the triad of C? Three clinical triad C, typical C, in Cushing reflex. It's a cold and blind skin, nervousness. Your answer is incomplete. We won't be able to give you a fact check. No marks will be allotted to you for this answer. Because only only partial answer was given. Yeah, well, five marks for in D. Then increased intracranial pressure is associated with the increased blood pressure and bradycardia. And increased intracranial pressure causes hypoxia and hypercapnia to stimulate the vasomotor center. There is an increase of blood pressure, stimulate the pedal receptor that causes the bradycardia. Now, some interesting fact is considered to be the father of the modern neurosurgery. His technique significantly reduced mortality. From the mortality was reduced from 50% to less than 10%. Only because of the antiseptic at the liver anesthesia because in that point of time. Okay. He had a collection of more than 2,000 human brain and tumor during his career. He was a baseball player and was offered a professional cataract, but he chose medicine. One more interesting fact is that, with reference to the scientist, he was nominated 38 times for the Nobel Prize, but he could not able to get the Nobel Prize. Now for team E. Are you ready? Okay. Yes, sir. He is known for the discovery of the classical conditioning through his experiments with dogs. Um, okay. Full marks, 5 marks, 5 marks. The correct name is Ivan Pavlov. Now, what is operating condition? Tell it application. In operant conditioning, animal used to correlate between one behavior and one stimulus. And its application is क्या बोल रहे हैं सतीश? The correct answer is that the operating condition is a form of conditioning in which the animal is taught to perform some tasks in order to obtain reward or avoid punishment. Okay, just like learning and landing. Yeah. Some of the interesting factor starting in 1901, this gentleman was nominated over 4 successive years for the Nobel Prize in Physiology or medicine. He did not win the prize until 1904 because previous nominations were not specific to any discovery but based on a variety of laboratory findings. Now, in 1904, the scientists had received the Nobel Prize for physiology of digestion and not for the behavior or conditioning, which later would become the pair backbone
in the field of psychology. Thank you so much. At the end of round one, we have two teams leading with 15 points each, which are Team B, Mahatma Vidur Medical College, and Team B, Ames Gopal, with 15 points each. Next, we have two teams, Team A, GMCH Chandigarh, and Team C, Ames Gopal, with 10 points each. Next, we have Ames Library with 5 points. All the team members are requested to read the questions carefully. The specific point, please attention that because it's scoring the marks. Take your own time and do teamwork properly. All the teams, I am requesting all the teams read questions properly. This is a break for main teams. You can take a break for from home. Audience ready? So there are a group. There is a group of three questions. Each will be having around 30 second or 20 second. So pin 412337. Pin is 412337. There is a limit, maximum 40 can join. So join fast. You can even use textbook also for the answers. But everything you have to do it in 20 or 30 seconds. So till now 21 of you have joined. Once this round is over, I will request that some student may shift to these benches in between. Join fast. Medal is waiting for you. Certificate is waiting for you. So now I am starting. Now I am starting. Clone बना. अरे who? You have to take audience. See the audience now. It is a rest for you, so that you become freshen up for your next round. So every round there will be audience round. You need to relax. All the teams. Second question now. Last question. So let us see now who is the topper.
Third is Laurav. Second is Mukul. First is Sarvik. I would request Sarvik to come forward. I would request Bharta Madam to hand him certificate and honor him with the medal. However, the name can be written afterwards. Yes, medal. So now we will be starting with the second round. Okay, ready? Now, first round we have started with the A, so we'll be starting now with E. The second round is a second round is recent advanced round. So first of all, I want to relieve your anxiety regarding that. We are not going to ask you any recent things. Rather, we are going to tell you some recent things going on and some related some related facts regarding physiology is only thing which we are going to ask. So don't worry, we will not be asking the recent things. So a picture would be displayed and or interesting fact would be told followed by two sub question. There are 20 points with two sub question. If unable to answer first sub question, answer may be told or may not be told depending on whether it is related or not. Score would be awarded either 0 or 10. It is all or none. You have to answer complete. If your answer is incomplete, you will not get no marks. So 30 seconds for each question is there. No negative marking, no passing. Yes. So can you tell me what picture this data set about? What you come to your mind from this picture? Don't worry, this is not question, so you can guess anything. Okay, this is like a voice biomarkers. Voice biomarker can help to detect pulmonary hypertension and mental health issue. There are also artificial intelligence powered cough analysis app like Cough Tracker. Still, in this area, there are many challenges out there. So, now your question is how coughing is different from sneezing in terms of after response. So you have to answer in this term. After now, for cough reflex is and sneeze reflex is. Now simply the timer starts now. Now I am telling you you have to take sneeze. Second chance will not be given to you. So take full 30 seconds and then only answer. For cough reflex and for sneeze reflex. Start your answer. Start your answer.
So for the cuff reflex, it's internal laryngeal nerve.
Branch of
Branch of Hales nerve.
okay.
And for the sneeze reflexes, the phrenic nerve.
Phrenic nerve. Your first part was correct, but second part is not correct. So you will get 0 mark for this. Anybody know? Audience? Sarvanik? I can call roll number, but अभी इतने absent है मैं roll number ही बोलता रहूंगा और roll number 91 is present. I know. Roll number 91. Can you answer? Okay. What answer? But no points. Okay. And it is branch of. We are not. It's trigeminal nerve. Okay. We will go to question 2. Again from physiology. No need to worry. It is not recent thing. What would happen to break point when carotid bodies are removed? Your timer has started. You have to justify answer with reason.
Carotid bodies are more factors on
Yes.
the function of the internal carotid and the external carotid arteries. These are activating the hypoxic supply of the hypoxia. The supply of the bodies are 2000 ml per minute per gram.
What would happen to break point? Sorry, now I can't give you answer. You have taken enough time. Breakpoint is a very frequent phenomenon which we study, especially in practical like statography. So when carotid body are removed, breakpoint is going to be increased. It shows very simple answer. Since the partial pressure cannot be detected. Okay, so team E gets 0 for this. Team D ready? So can you tell me what it is? Again, there are no points for it. You can guess. Even audience can guess also.
Field learning in medicine.
Okay, somewhere correct. So it is a tailor medicine or personalized medicine that is was created by AI. So you can call it as a hyper personalized medicine. It allows tailoring of treatment based on patient genetic makeup, lifestyle, environment. Treatment will change depending on various factors. For example, diabetic person if you compare with hypertension, without hypertension, both treatment is going to be different. So that is one of the very simple example of personalized medicine. So there are various reasons for it. One of the reason is interaction amongst various hormones. So now there is a question. Okay, so be ready with the question. So your question is, what do you mean by permissive action? Explain with one example. Name of hormone with action is required and your time starts now. Take at least 15-20 seconds, then only start answering.
So, permissive action is like when the action of one hormone frustrates the action of other hormone or increases its action. And the example can be thyroid hormone increases the beta receptors on number of beta receptors on the heart, thereby facilitating the action of catecholamines on the heart.
Okay, so that is a correct answer. In our example, in three, we have not written example of thyroid hormone, we have written example of glucose. Still, it's correct answer. So, second question is, tell any two condition where glucocorticoid secretion is increased. I am repeating, it is condition, it is not the disease. So again, I will advance take through 30 seconds and then answer. Tell any two condition, not disease, where glucocorticoid secretion is increased. I am sure audience know the answer.
Sir, in case of stress
Stress 1 second.
and starvation,
Starvation, right? Can you tell me how starvation, you have got marks, but please tell me how starvation will lead to increased glucocorticoid secretion?
so like in case of starvation, there will be decreased energy supply to the cells. So
Can
the
you be specific? Decreased energy supply means?
like to decrease blood glucose levels.
Yes, because of decreased blood glucose, hypoglycemia is one of the condition. So these are the various drives for because of which glucocorticoid secretions are increased. There are many. So now team C, ready? So can you guess what it is?
I see an MRI machine, so it is something related to diagnostics.
Okay, most of you are just telling it as a MRI machine, but like there is a one term known as adaptive radiation therapy. That machine may look like this. So adaptive radiation therapy is a customized adjustment of radiation on the need of patient. Thus, damage to healthy tissue is prevented. So that is the adaptive radiation therapy unit. So impact on ART on immunity would definitely be less compared to that of conventional radiotherapy. You know that cancer patients are having various immunological problems. So this can be prevented because of this adaptive radiation therapy. So your question is, which type of peptide fragment does MSC class 1 protein react with? And your timer starts now.
So the MHC class 1 proteins react with the CD8 cluster of differentiation proteins, and they are present on cytotoxic T cells and help against tumor and viral infections.
Okay. So they have told correct answer, especially they have told about tumor and viral. That was the correct answer. So plus 10 for it. So next question is, which immunoglobulin has highest and lowest concentration in the plasma respectively? Your timer starts now. One with the highest and one with the lowest concentration in plasma.
So the one with the highest concentration is IgG, and the one with the lowest concentration is IgT. T cell receptor. So you don't use
IG?
T.
I think your answer is wrong. First part is correct, but I have told you for part answer you can't give you marks. This was correct, first question. So second question is IgG and IgE. Okay, so concentration is also given. So now team B, ready? So you want to say anything from this picture?
It may be something related to sports medicine.
Yes, it is something related to sports medicine. So we'll see what it is. So this is one of the paper where effect of drinking too much water before the race is shown. This highlighted is the paper. So in this paper, author found that there were no signs, there were no symptoms of hyponatremia despite of plasma sodium decline in female runner during 7 stage ultra marathon. So exercise induced hyponatremia is observed in endurance exercise as well as shorter sports activity. Hydration play important role in any sports. In the given paper, various physiological changes as a result of training might have resulted in the ability to cope with the hyponatremia. In addition, there are various disease conditions where electrolyte imbalance is seen. So these are some of the points related to this paper. So your question is, name the type of abnormality seen in diabetes insipidus. Numerical it's mentioned, you have to tell whether it is hyponatremia or hyponatremia, dehydration or overhydration, or hyperosmotic, hypoosmotic. Your timer starts now. You can take your time and then answer. Think and answer.
Sir, hypernatremia, dehydration, hyperosmotic.
Hypernatremia, dehydration,
Hyperosmotic.
hyperosmotic. Okay. We will just check the answer. After question 2, I will be telling. Just make a note. So what change would be observed in the resting membrane potential of the nerve fiber with hyponatremia? Justify. Your timer starts now.
There will be a decrease in excitability of the nerve fiber because of the decrease in concentration gradient.
Okay. What was your first answer?
Sir, it was hypernatremia, dehydration, and hypoosmotic.
Okay, you have make a note.
Sir, hyperosmotic. Hypernatremia, dehydration, hyperosmotic.
अब पहले क्या बोला था? हाँ, ठीक है. So question 2 is wrong. See, sodium is not fully permeable to resting membrane, to cell membrane. So that is why resting membrane potential is not going to be affected. During action potential, it is going to be affected, right? So we see now answer to question 1. So it is hypernatremia, hyperosmotic dehydration. Is it correct? Okay, so you get plus 10 for them. And just I have told you, because of size of hydrated ion, sodium ion is not permeable. Okay, so team B get plus 10. Please make a note. So team A, ready?
Yes, sir.
So now there is no picture. So all of you know that vestibular nucleus is associated with motion sickness, but nowadays it has been found that it is also playing role in obesity control. So this is one of the paper where this effect of obesity control was seen on vestibular nucleus. So this is a diagram is also shown here. So if you see this KIR means it is inward rectifier so potential channel. So significant effect was seen in response to high fat diet. In one, no increase in weight was found. It was increase in weight was found. And vestibular nuclei was playing role in this. So now your question is, name any two parts or components of vestibular nuclei. Your time starts now. Any two parts or components of vestibular nuclei. Audience, be ready. Now your round is about to start. Yes, answer. Okay, so you get +0 for it. Okay. Tell effluent for data nuclei.
Sir, we don't know this.
Don't know. So they get 0 marks for this question. I thought this question was one of the easiest question. So it was superior, lateral nucleus, medial, spinal. So these are some of the parts of vestibular nucleus. And effluent of data nucleus is lateral vestibulospinal tract. So this was this answer to this question. So this diagram you might have been aware. This diagram is from Gano. So by the time our scorers are ready with the scores, I will make audience busy. We are on time. You want to take break? You can take break. But please don't help audience. So now I am starting. Ready? Now we'll move to the next question. It is 2024, okay? Awesome. So third is Vedant. So Vedant is sitting here. So, AN, who is AN? Who is AN? Please come forward. Medal is waiting for you, medal and certificate. Please come forward. Who is AN? I will request Varun sir to come forward and give certificate and give medal to Amina. It is Amina or Anima? Yeah. So Niranjana, at least you join. You can join for the photo.
the end of round two, we have the leading team as Team B, Ames Bhopal with 35 points. Next, we have Mahatma Gandhi Medical College with 25 points. Next, we have Ames Bhopal Team C with 20 points. Next, we have GMCH Chandigarh with 10 points and Ames Library with 5 points.
Teams are ready. Let's start with the third round, that is the calculation round. We'll start with the team A. So the general rules and information for this round is, while answering, the unit is must. You should say whether it's gram, milligram, and whether it's a positive sign or a negative sign, that should also be included. Calculator will be provided if wanted, and log of any value if wanted, that will also be told to you. Maximum is 20 points. The right answer gives you 10 points, and the steps of the formula for the calculation gives you 10 points. The total time here is 2 minutes. Passing is permitted if the team doesn't answer anything or say pass. Passing is permitted without no additional time. Within that 2 minutes itself, you're supposed to answer. For past question, maximum 10 points will be allotted. No part solution. For part solution, you'll get a 0. No negative marking. Let's proceed with the calculation round. Yeah. So you should tell the units, whether it's gram, milligram, ml, those things. Calculator. So correct answer will give you 10 points. Calculation steps or the formula will give you next 10 points. Total time is 2 minutes. Passing is permitted. If you don't answer anything, it will be passed. If you answer something, it will not be passed. No negative marking. Right? So we proceed. First question to team A. Calculate the free water clearance from the given data. Plasma osmolarity is 200 milliosmoles per liter. Urine osmolarity 250 milliosmoles per liter. Urine flow rate is 1 ml per minute. Your time starts. 1.25 ml per minute. Is it final answer? Yes, sir. It's also wrong. And right, they have to ask you tell the steps of conclusion. So the free water clearance, the formula is U into V by T. So U is the urine osmolarity, V is the volume flow rate, which is the urine flow rate, and P is the plasma osmolarity. So the steps would be 250 into 1 divided by 200, which comes out to be 5 by 4, which is ultimately 1.25 ml per minute. And so this is incorrect. We get a 0 for this. The answer is negative 0.25 ml per minute. So the clearance, free water clearance is the urine flow rate minus the flow rate that is isoosmotic with the plasma. And the complete formula is the clearance is UV by P, that is you calculated it. After that you're supposed to subtract it with the urine flow rate and finally get minus 0.25. Right, this is the complete solution.
But you the answer the 1 unit each. So it can take 2 minutes. Just please don't see no confusion. But you the answer unfortunately.
We have complete 2 minutes for this. So the next calculation, the second question goes to team B. A 23-year-old female was exposed to cold environment of 25 degrees centigrade. Since her homeostatic mechanism were intact, her temperature fell from the set point of 37 degrees to 36.5 degrees centigrade. If you take another scenario where her homeostatic mechanism is dysfunctional due to which her temperature falls to 25 degrees centigrade, can you calculate the gain from the given data? Your time starts. There are two conditions where the homeostatic mechanism is intact, and the other condition in the scenario where the homeostatic mechanism is not functional or dysfunctional.
So the answer is minus 0.43.
That's incorrect. Enumerate the steps of how did you calculate?
So mean is equal to correction upon error. Correction is equal to corrected value minus the original value that is 6.5 minus 37, and then that is 36.5 minus 20. Correct.
Solution is correct. Most of the state formula they have over
Get tested for the steps. However, your calculation, the answer is incorrect. The answer is minus 23. The set point is 37. Error is 37 minus 36.5, that is 0.5. The change that is happening is 12. Correction is error minus change, that is 0.5 minus 12, that is minus 11.5. Gain is correction by error, that is minus 25. So this is your solution. You get a plus 10 for the calculation. Next, so the question to the team C. If 3% of calcium chloride is
added to ECF, how much milliosmoles do we added to the ECF? If the atomic weight of calcium and chloride is 40 and 35 grams respectively. Your time starts. So approximately 0.81 osmoles, milliosmoles per liter osmolarities for the plasma. To calculate the osmolarity, we perform that 3% calcium chloride is added. We can calculate the molecular weight of calcium chloride as 110 units. From that, we can calculate the number of moles. And since calcium chloride will dissociate into three constituent ions, so valencies will be multiplied by 3, and that would result into one nearly 0.81. The answer is correct. The steps of calculation is also correct. Get plus 7. So it's 818 milliosmoles or 0.8 osmoles. And 3% calcium chloride, this means that is 30 grams in a liter, which will give a molecular weight of 110 grams per mole. So it is 0.272 mole of calcium chloride has been added. Since it is giving 3 osmoles, so 0.272 multiplied by 3, you get 0.818 is the right answer. Plus 20 for this TMC. Next. Think everybody? This is your question. Calculate the functional residual capacity from the given data. The method used was nitrogen washout method. The concentration of nitrogen in the collected air is 55%. Volume of the air collected is 50 liters. Concentration of nitrogen in the air is taken to be 80%. Your time starts. The nitrogen washout method. So the answer is 3.125 liters. And the steps to be performed are the C1 is equal to C2. So concentration in the collected air into the volume of the collected air is equal to concentration in the of nitrogen concentration in the air, that is 80%, and into the volume, which is the flux. So by that we would. So the answer is correct. You get a plus 20.
As is 3.1 to 5 liters. Yeah, so then this QE. So, okay, last. This QE. You ready? Calculate the velocity of blood flow in the aorta from the following data. The heart rate is 80 beats per minute, and diastolic volume is 100 ml, and systolic volume is 60 ml. Diameter of aorta is 20 millimeters. So 318 centimeters per second. Steps of the calculation. Volume is equal to area into the length. The volume is the stroke volume, which is interstomic volume is intrastomic volume is 40 ml. The area will be the pi r square. The diameter of the aorta, the medium of the aorta, that's the medium. Pi will give it and the length. And the answer the length person. The answer is incorrect. So let's check the. So this is the answer. Velocity is Q by A, where Q is the cardiac output, which is 3,200 nm per minute, and area is the area of the cross-sectional area, that is 3.14 into 10, that is 100 millimeters square. So, answer is incorrect. That's partly correct. The calculation part was correct, so we get a plus 10. So this completes our third round.
Audience ready? I will give exact 1 minute to join. Be fast. 8947867. So 1 minute is about to up. Only 5 seconds remaining. So now I am starting the round. It's very easy round. Do calculation fast and get the medal. Question number 2. Be ready. Last question. It is the refractory period of relaxation period. No. It is refractory. It is relaxation period, not refractory period. Okay. RP is relaxation period. RP relaxation period. Sarvanik misses the medal by 3 points. Which Jayan, please come forward with Jayan. Jayan, come forward, otherwise second will get the chance. I would request Shilpa ma'am, Professor Physiology to felicitate our winner of the audience round. Please. So we will be starting with the audiovisual round. So last round we have started with whom? Okay. So now we'll be starting with you. So this is the audiovisual round where Hollywood or Bollywood movies clips will be shown to you and some related questions will be asked to you from that. I can call this sound as movies through the eyes of doctor. Why I am calling it, you will come to know. So general information again, there are 20 points, two sub question. So if unable to answer first sub question, then answer would be given and then next question will be asked. Score avoided here again 0 or 10. You get 0 or 10. Complete answer is must. No part answer is permitted. 30 seconds for each sub question. No negative marking, no passing. No problem with the rules. Almost same. So let us start. Everybody has seen this movie? Alive? Alive is a survival drama based on the true story of a Uruguayan rugby team whose plane crashed in the Andes mountain in 1972. The film powerfully depicts the harrowing 72-day ordeal of the survivor who were forced to resort to cannibalism to stay alive in the harsh mountain condition. So this was something about the movie. So your question, something related to this is, what are the cellular acclimatization changes seen in response to acclimatization to low PO2? And you have to tell, your timer starts now. Any two cellular acclimatization changes. Take time, don't be in a hurry, all teams. It is not passing, okay? Time is up. Increase in the erythropoietin hormone, number of RBCs increases in general of the blood. Decrease in the level of 2,3 DPG so as to increase the dissociation of the O2 in the cellular level. Okay, I can't give you answers. The question is about cellular acclimatization changes. So cellular changes are asked you. Cellular means what is happening at the level of cell. Erythropoietin, RBC, these are not the cellular changes. These are like what is the change going on mitochondria, what are the various changes occurring in enzymes, cytochrome oxidase, all that you will call as the cellular changes. These are very clearly given in your all physiology books. Okay, so no worry. Second question. Second question is very easy. Initial ventilative response to high altitude is small since alkalosis tend to counteract the stimulating effect of hypoxia. However, ventilation steadily increases in the next 4 days. What is the mechanism responsible for this? Should I read it again? Initial ventilatory response to high altitude is small since alkalosis tend to counteract the stimulating effect of hypoxia. However, ventilation steadily increases in next 4 days. What is the mechanism responsible for this? Your minutes has started. Last 2 seconds. The initial alkalosis will counteract the hypoxial effect. by increasing the ventilation, but that will lead to long-term alkalosis, which will lead to reduction in the 2,3 DPG and permanent shift of left side to upper, but it will not occur. And the mutase enzyme will be eliminated due to alkalosis. No, this is not the answer. It is related to some removal of carbonate or that which is occurring by the kidney or at the level of your brainstem nucleus. Anyone you could have told. So these was the answers and mechanism responsible. This is very commonly asked Viva question. In kidney, it is increased bicarbonate excretion, and in CNS, it is active transport of hydrogen ion in CSF and lactic acidosis in the brain. Okay, so you get no marks for it, 0 marks. Team B, Team D, ready?
अंतरिक्ष यात्री सुनीता विलियम्स और बुच विल्बोर 9 महीने अंतरिक्ष में रहने के बाद धरती पर वापस आ गए हैं। भारतीय समय अनुसार बुधवार तड़के करीब 3:27 पर 4 अंतरिक्ष यात्रियों को लाने वाला ड्रैगन कैप्सूल फ्लोरिडा के तट के पास समंदर में उतरा। सुनीता विलियम्स जब अंतरिक्ष यान से बाहर निकली तो उनके चेहरे पर मुस्कान थी। स्पेस स्टेशन से अनडॉक होने के बाद ड्रैगन कैप्सूल को धरती पर पहुंचने में 17 घंटे का समय लगा। ड्रैगन कैप्सूल ने पृथ्वी के वायुमंडल में तेजी से दोबारा प्रवेश किया, जिसके बाद 4 पैराशूट खुले और उन्हें फ्लोरिडा के तट पर धीरे से नीचे उतारा गया। पृथ्वी के वायुमंडल में प्रवेश करते समय इस कैप्सूल की रफ्तार 17,000 मील प्रति घंटा थी, जिसे कुछ मिनटों के अंतराल में तेजी से धीमा किया गया। नासा के वाणिज्यिक क्रू कार्यक्रम के प्रबंधक स्टीव स्टिच ने क्रू मेंबर्स की तारीफ की है। दोनों अंतरिक्ष यात्री सुनीता विलियम्स और बुच विल्मोर जून 2024 में स्टारलाइनर स्पेसक्राफ्ट के जरिए इंटरनेशनल स्पेस स्टेशन पहुंचे थे। इसे बोइंग ने बनाया था। स्टारलाइनर में आई खराबी के कारण वो वहीं फंस गए थे। उड़ान के दौरान जब ये यान आईएसएस के करीब पहुंचा तो उसमें समस्याएं पैदा हो गई थी।
So this was Sunita Williams who have made us proud. So this is the video about news about Sunita Williams. So Team D, can you tell me which was the other astronaut with Sunita Williams? Yes, answer was there. Be fast, you will get negative marks.
Sir, what is something
Huh? Butch Wilmore, but don't worry, this is not your point mark question. So your question is, what would happen to an astronaut who just returned from the space on his attempt to stand? You might have seen in the video that she was not able to stand. So what would happen to her when she attempt to stand? So your timer has started.
So, due to the effect of microgravity in space, the adaptation reduces the tone in the muscles, and also there might be disease atrophy because of the microgravity, as that much effort is not required as is on the Earth. So, the effect if they attempt to stand, they may stand and they may fall.
No, your answer is not specific.
So, because of disease atrophy, the muscles have become weak, so they can fall down.
What is the specific mechanism for it?
So, tone is decreased over time.
Specific answer is expected.
So, because of disease atrophy.
I can't give you marks because it is related to your cardiovascular system, baroreceptors, because they will be not be playing role here since because of microgravity. So, question 2, no worry. Sunita Williams would be undergoing rehabilitation for certain duration, and with rehabilitation, she would attain normal physiology. Post rehabilitation, if an ECG is recorded in the phase of expiration and the phase of inspiration, what would what would be the normal ratio of average RR interval in expiration to that of inspiration? Justify. You have to tell with respect to whether it will be one exactly or more than one or less than one. Post rehabilitation ECG is recorded. So post rehabilitation means physiology has attained.
So in normal physiology, the heart rate is greater in inspiration, so the RR interval in inspiration would be less. The question is asking ratio of expiration to inspiration, so it would be more than.
Okay. So you get plus 10 for it. Okay. You might be wondering why diffuse atrophy was not the reason. See there, it was specifically asked immediately. Diffuse atrophy में ऐसा immediate थोड़ा तो if CVS is intact, something will be tried there. So that was the reason you don't get marks for it. Okay. So plus 10 for them. So Pushpa making appearance second time in a row in our quiz.
The flower fire, fire.
See, Hindi clipping was available, but I purposefully inserted South clipping because I found it very appealing. And I think Team C member doesn't like Bollywood movie. They generally watch Hollywood movie at least, but he got only that Bollywood movie one. So question is very interesting. So in the Pushpa movie, one of the shoulder is raised, or you can say that other side is dropped. So your question is, if any patient came with the complaint of right side shoulder dropping, which nerve palsy would you suspect? So, and see here, tell any one clinical examination to test this. Now I am repeating before starting the timer. You have to tell whether it is right, left, and clinical examination should be specific. If you tell wrong, I will not entertain any other. Okay? So your timer starts now. Right side shoulder dropping, which nerve palsy would you suspect?
Sir, we would suspect right side spinal accessory nerve palsy because it supplies the trapezius muscle, and the clinical examination to test this would be the examiner stands and tests the shrugging of the shoulder against resistance.
Plus 10. Question 2. During power examination, when the examiner says that power is 2, what does it mean? Your timer starts now. This is a very frequently asked question during practical exam.
And during power examination, grade 2 meaning that the patient is able to move the arm, but if he tries to do so against gravity, he would not be able to do so. He will be able to move if gravity is not interfering.
Okay, so plus 10 for them. So they get plus 20 for it. Here, when gravity is eliminated, we can do it. So, team B ready?
was secret. You thought their purpose was to heal, and you thought they could be trusted. You thought if you laboratories, improvements with the same husband, a secret research project is underway. But to be a part of this team, part of the experiment.
So this field is based on the research where researchers are themselves the participant. Here work on the development of synthetic body parts, specifically bionic muscles, is done without ethical or legal constraint. One of the participants was involved to help his brother with muscular dystrophy. So your question is, what is the function of dystrophin glycoprotein complex? Timer is started.
So the dystrophin glycoprotein complex adheres the actin to the sarcolemma and it therefore to the and also to the extracellular protein. And therefore it is helping in the strengthening of the muscle contraction. It is providing stability in kind of like muscle contraction increases the strength of the muscle contraction.
Okay, they have answered almost correctly, or at least more than 70-80% they have answered correctly. So I will give plus 10 for them. So question 2 is, which band does not show any change in its length when muscle is relaxed or contracted? Please justify.
So length of A band remains same because it only consists of the thick fibers, which is during the contraction, since there is sliding of the thin fibers, the I bands get contracted, but A band remains same.
Okay. So plus 10 for this, so plus 20 for this question. So team A ready? So they have answered correctly. If you see by some this stuff, they provide scaffolding for the fibrils and they connect to the extracellular environment. Function of dystrophin glycoprotein complex. So this is a dystrophin glycoprotein complex. So this is a A band. Now we will move to team A. Team A ready?
You're aware that you voluntarily embarked on a PhD in physics. Hello.
Claire,
Science.
art.
I'm a cosmologist.
What's that?
I study the marriage of space and time.
Perfect couple.
One never knows from where the next great leap forward is going to come. Often know. What if I first time to see what happened at the beginning of time itself?
Way back the clock.
Why about the clock? Keep going.
Great.
Disease. Life expectancy is 2 years.
Just getting together for as long as we've got.
You don't realize what lies ahead. This is going to be a very heavy field.
I love him, and he loves me. We're going to fight this illness together. Good luck.
Are you okay? So, this black hole at the beginning of time. Brilliant. Brilliant. Well done, Doctor. Yes, pneumonia. The only way we survive is to give him a tracheotomy. And we never speak again. Yes, he will. My name is Steve Hawking. It's American. It has been a great joy to watch this man defy every expectation, both scientific and personal. There can be no boundaries to the human endeavor. However bad life may be, while there is life, there is hope. Thank you. Sorry, did you say something?
Where there is a life, there is a hope. And one of the line was there, well done, doc. During that PhD work, he is suffering from autoimmune disease, but still he went on to complete his PhD, and all were proudly saying about him. So where there is a life, there is a hope. So this is about the movie Theory of Everything and the challenges faced by Stephen Hawking when he was diagnosed with motor neuron disease. So question, ready? Team A? Tell the origin percentage wise of corticospinal tract. Your timer starts now. Take 30 seconds. Please don't be in a hurry. Time is up. Okay. Next question. Descending tracts are divided into medial or ventral and lateral pathway. Name any two tracts of each pathway, medial and lateral. I think audience know the answer. Sorry, lateral medial and corticospinal tract. Okay. I can't give you answer for this because you have to give complete answer. So this is the origin wise percentage is given, and medial and lateral, this is the division. Lateral is lateral corticospinal tract and rubrospinal tract, and medial is R reticulospinal, V vestibulospinal, T tectospinal, V ventral corticospinal tract. So score please. So by the time scores are ready, audience be ready.
At the end of round four, we have the leading team as Ames Bhopal, Team D, with 65 points. Next, we have again Ames Bhopal, Team C, with 60 points. Next, we have Mahatma Vidur Medical College with 55 points. Next, we have Ames Raebareli with 15 points and GMCH Chandigarh with 10 points.
I give exactly 1 minute. Second up. Last 5 seconds. So I am starting. Question number 2 now. Again, JN is leading. Question. So let's see who is the winner. Yes, Tushar, I would request Dr. Ruchi Madam to felicitate winner. Please bring certificate and medal.
So, good afternoon to all and best wishes to all the participants. So, we are starting with the fifth round, that is clinical cases and physiological basis. So, these are the general information and rules which are almost same. The case history will be displayed, maximum 20 points with two sub questions, each for 10 points. Sub question 1 will be diagnosis, and you will have to justify, and if unable to answer, then answer would be given. If in treatment part, drug's name is not needed, only the basis of treatment is required. Also, you can tell non-pharmacological treatment, right? Second sub question will be asked related to the question asked, and complete answer is expected. Correct answer is 0. 30 seconds for each sub question, and there is no negative marking and no passing, right? So we have to start with team A this time. So ready? So your clinical problem is a 52-year-old male, Mr. XYZ, a military professional, came with a history of bullet injury to the spinal cord in the lower thoracic vertebrae 4 weeks back. He was treated in a military hospital and then was referred to a specialty clinic. The patient complained of sensory loss and decreased power on the left side. There were no other complaints. On CNS examination, the following findings were seen: impaired fine touch and vibration on the left lower limb, impaired pain and temperature in the right lower limb. Power was grade 1 in left lower limb. Knee and ankle reflex were exaggerated on the left lower limb, and plantar response was extensor on the left side. So your question is identify the question, identify the condition, and justify. Your time starts now.
Yeah, you should go to the question now.
Question is you have to okay, but time का देख लो please. I think time is up. It was 30 seconds only. So haven't you heard of this situation?
Unfortunately, in our college, we are still at renal physiology. So every question we are getting is of CNS, and we haven't read that much yet.
We are trying to start from either side in each round, but it is really hard luck for you people. I cannot say anything at this point of time. But but we try to make it as fair as possible by changing the sides.
Yes.
So though we will not be giving any marks to other team, anyone who wants to answer this. Anyone apart from our aims Gopal. Chalo, बताओ, teeny. It is Brown-Sequard syndrome, right? Have you heard of this?
Yes, ma'am, but we don't know the pathophysiology.
So sorry for that. We क्या कर सकते हैं? Okay. The marks are 0. The second question, it is again related to this. While undergoing the case file, it was found that reflex was absent on the left lower limb in earlier days post injury. However, on the day of examination, exaggerated reflexes were observed. Justify the finding with reason. Will you be able to answer this? So sorry for anyone. TV, would you like to answer this? We won't be giving it marks, but just for the purpose of knowledge. No. Anyone else? Why there is the reflexes were absent initially, but they were exaggerated at the day of examination after 4 weeks of injury. Anyone? Chalo team D.
Might will develop their own activities irrespective of the input from the other words. So later there will be reflexes, but initially
There is spinal shock.
yes,
Right. Okay. Seconds for each sub question. But they need the question. Then I have to go back to the clinical problem. Okay, then. Okay.
Take time, what point, want to note any point, then only we start with.
Read the question कितना time देंगे? ठीक. Right. So we are moving to the next team, that is team B. I hope this question is clear, so I am not going in detail of this. Coming to the second clinical problem for team B. A 44-year-old female patient came with a complaint of loose motions, 13 episodes in last 12 hours. There is history of nausea, however, there is no vomiting. On examination, vitals were mildly deranged. However, admission was not required. Stool microscopic examination was not suggestive of any bacterial infection. This is your clinical scenario. If this is clear, I can move to the question. Is this clear? Clear? Okay. So your question one is, vitals are deranged in this patient. If we consider pulse and BP, which parameter will be the ideal parameter for evaluation of this patient and why? Your time starts now.
Pressure would be the ideal parameter because since there is loose motion, there is a loss of water. So the ESF volume, blood volume will decrease, and that will decrease in cardiac output.
Okay, but I am so sorry. The answer is pulse. Okay, heart rate or the pulse rate, because the blood pressure is many a times misleading. Okay, because you must have heard about the last ditch, that baroreceptor mechanism, and it tries to compensate for the blood pressure. Yet the volume, there may be the loss of volume, which is better represented on pulse examination. So you do not get any marks for this question. Second question is, how will you treat this patient? And tell the physiological basis of treatment.
Ma'am, we will be treating by ORS to maintain the electrolyte balance in the extracellular fluid. And
what is the basis for this treatment?
Since there will be the adequate amount of the sodium, potassium, and other electrolytes in the fluid, so there will be proper reabsorption.
What is the role of the sodium in this?
Ma'am, it will help in the water reabsorption.
What is the mechanism?
Import of water along with the sodium reabsorption.
Is it simple?
Ma'am, it is along with sodium, water is also due to the osmotic effect of sodium.
ORS is correct, but the mechanism you are telling is not correct. It is secondary active transport. And you answered it as Simport and electrolyte balance and everything. So we are so sorry, we are not giving you the.
Actually, isn't Simport like a classification?
Import what it's not exactly. You should have told this import is leader.
The energy that is being utilized is because of the transportation of the sodium. Therefore, it is secondary active transport and not Simport. Right? So you are partially correct, but we are sorry we won't be able to give any marks for this. Right? So we are moving to the 13th C, and we have already discussed this the physiological basis. And so coming to team C, your clinical problem is a 40-year-old male patient was diagnosed as a case of hypertension in routine medical examination. He further gave the history of increased blood pressure on routine medical examination 1 year back, for which he had not started any form of medication. He does not have any other complaints like chest pain, breathlessness, swelling, and palpitation. Patient was called back with ECG. Is the problem clear? Right? So I am moving to the first sub question. This is the ECG. You can see we have the first lead, second lead, and third lead recording. You want to note down something? So I am moving to the. I'll move back to this slide. Okay? The question is, what finding will be observed in the ECG in this patient? Justify. Echocardiography in this patient. Justify. This is the ECG. It's a patient of hypertension.
I think the ecocardiograph is used to measure the stroke volume by calculating the volume into ventricle, which means the patient presents with hypertension. I think the ventricle would be spaced to leading to increased stroke volume. So, ventricle hypertrophy can be seen.
Correct. So the patient is having left ventricular hypertrophy.
Clear cut finding is ECG finding. One I noticed there was
There was T-wave inversion seen in ECG.
Like, what is that? Can increase.
Anything else? ठीक है, we'll read a second.
Negative SOA.
Sir, to answer the question, moving to next second sub question. Tell the physiological basis of any two form of modalities of your time starts.
Ma'am, one of the physiological modality would be anti-hypertensive drugs like ACE inhibitors. So ACE inhibitors work by inhibiting angiotensin converting insulin, preventing the conversion of angiotensin 1 to 2. If the hypertension is particularly severe, another modality can be use of certain diuretics. And so diuretic can be of various classes like osmotic diuretic or carbonic
What
and
will be any type of diuretic? What will be their main physiological basis?
like I explained, loop diuretics like beta-samic acid, butadiene, etc. So they work by inhibiting the NKCC2 channel in the ascending thick loop of membrane. So they will prevent the reabsorption of iron. Iron will remain in the tubular fluid and water will be retained along with it. So volume will deplete and hypertension will resolve.
Main intention. So we have full marks for this and full marks for the entire question, right? So we are moving to the next theme, theme B. So your clinical problem is a 56-year-old known case of diabetes and hypertension came with the complaint of disturbed walking and altered speech in last 1 month. On neurological examination, short scuffling, gait, kinesia, and resting tremors were found. Tone was increased. Are you clear with the problem? Check it. Question is identify the condition and justify. Your time starts.
All condition is Parkinson's disease because the characteristic is the resting tremors and the akinesia or bradykinesia.
We question. Tell the physiological basis of any of the two symptoms which were observed in the patient. जो आपने explain किया है, its physiological basis. Your time starts. The symptoms.
Akinesia is developed because the along with the nucleostriatal pathway is damaged. Also in the dopaminergic pathway, the nucleus accumbens is also damaged, and which is responsible for much of the movement right to perform anything. So the drive is so much reduced that the person cannot initiate anything. That would be akinesia.
For resting tremors, there is alternate contraction. There is because
So we not ask for both the sub questions. So team E have successfully answered the fourth clinical problem. So we are coming to the team E for the clinical problem. Fifth, so we have 33-year-old marketing executive who has a complaint of pain in upper abdomen, especially in epigastric, for 2 days. On inquiry, the patient does not have a history of vomiting or loose motion. There is a history of similar complaints in the past. Due to his occupational needs, he frequently has to eat outside. Patient is occasional alcoholic and chronic smoker. His vitals are stable and systemic examination is normal. Once you are clear with the question, we can, with the clinical problem, we will moving to the question. So here is your question. What is the probable diagnosis and justify your answer? Your time has no. I have given you ample of time. No murmuring, please. Your time is up. Your time is up. We won't
Wrong
be giving
period.
you marks, but answer करो चलो.
Long range use astronaut.
Yes, ठीक है तो bronchial disease ना से. Anyone? Team A? ये न्यूरोलॉजिकल वो नहीं है. प्रॉब्लम नहीं है. क्यों आपने पहले क्यों नहीं देखा? आधा घंटा तो मिलता था. बड़े लेजी बच्चे हो सब. बताओ. Yes, it is the practical sir. इतना इतना क्लियर कट किया हुआ है. So the answer for this is practical sir. Now the second sub question. Will they be getting if they answer the second sub question? So how will you treat the patient? Tell his physiological basis.
मैम जो नॉन स्टेरॉइडल एंटी इन्फ्लेमेटरी ड्रग्स that can worsen this condition, so we will if patient is taking them for any way, then we will suggest not to take them. And we will ask patient not to take any stress because catecholamines or
तो NSAID इसलिए नहीं आता ना, तो इसलिए फर्स्ट वाला आपका जस्टिफाई नहीं. ये तो frequently he was taking meal from outside. He was not on any medication. And second, what you were saying?
it was spicy food and it was the mucus barrier was like disrupting, so that also was
Check. The time is up. Sorry. Anyone? टीम में आपको बता दिया पेप्टिक अल्सर का पेशेंट है, क्या ट्रीटमेंट देंगे? पीपीआई देंगे. ठीक है? चलो. So tell me the score for this entire session.
the end of round 5, we have Infobot leading with 85 points. Next, we have again Infobot team C with 80 points. Next, we have Mahatma Vidhu Medical College with 55 points. Then we have AIMS Delhi with 15 points and GMCH Chandigarh with 10 points.
Okay, we will do one thing. This audience round we will be conducting in the end. Okay, so we'll come back to this round afterwards. Reason is we are just short of time. Ravinath is invited to conduct this round. This is the second last round.
So, very good evening. So, let's start with the transduction and signaling mechanism round. Signal transduction is the crux of learning physiology. So, you all are familiar with it. So, let's start with the T. T. Okay. So, these are the this is the general information and rules. So, some facts would be told, followed by two sub questions. Maximum points for each question are 20, with two sub questions each carrying 10 points. If unable to answer first sub question, if required, then answer would be given and next question would be asked. Score awarded would be either 0 or 10 for each sub question. Complete answer is must. And the time is 30 seconds for each of the sub question. There is no negative marking and no passing. So, Teamy, are you ready? So, here is your question. When the light falls on the cone pigment goes through a series of conformational changes and activates various events to cause phototransduction. So, question related with this fact. Tell the series of events in sequence once the cone pigment had undergone conformation change in presence of light. So, your time starts now. You have to answer before the timer goes off. Okay, so you're not in position to answer this question. Shall we move to next question? So here comes the second sub question. What is the side effect of sildenafil, the brand name Viagra, on color vision? Tell its mechanism. The time starts now. Okay, so the question remains unanswered. So we'll move to. So no marks are awarded for this team E. So the answer is these are the events that is rhodopsin when exposed to light undergoes conformational changes. GTP is replaced and the cyclic GMP phosphodiesterase enzyme converts the CGMP to 5-GMP, leading to opening of ligand gated sodium channel. And these are the sequence 1, 2, and 3. The answer to second sub question: what is the effect of sildenafil on vision? There is transient loss of color vision for especially for blue and green color, and this is due to inhibition of PD phosphodiesterase 6 enzyme. Okay, so we'll move to team D. Team D, are you prepared? Okay. So for team D, this is the question. Diabetes mellitus is one of the major health concerns in India. By the year 2045, diabetes mellitus patients may increase to 134 billion. So here comes your first sub question. Glucose is one of the important stimuli for release of insulin, which in turn increases the uptake of glucose. So here is the first question related with this fact. Tell the sequence of events that occur when glucose enters the B cell through GLUT2 receptor. Your time has started.
Sir, the glucose enters in the B cell through the GLUT2 receptors, and when it is first it is, by the help of glucokinase, it is phosphorylated to glucose 6-phosphate, and then it is converted by glycolysis to pyruvate, and then the tricarboxylic acid cycle operates on that and converts the final it into ATP. So ATP is released, and ATP inhibits the ATP sensitive potassium channels, so potassium efflux will be inhibited and depolarization will occur. So calcium induced exercises of insulin that was.
Okay, that's the correct answer. Well done, team D. So we'll move to next sub question. Insulin independent uptake of glucose occurs in response to exercise. What is the other mechanism of action of exercise in diabetes mellitus patient? Your time has started.
So in case of diabetes, like in case of exercise, the GLUT4 transporters are transported to the apical membrane of the muscle cells and other responsive cells. By the AMP activated kinase pathway, which stimulates their migration to the membrane, and because of that, activate glucose.
Okay, so yeah, so we will give you complete marks for these two questions. Well done, team D. So these are the answers. So this is the sequence of events that occur when glucose enters the B cell through GLUT2 receptor, leading to activation of ATP sensitive potassium channel and depolarization because of blockage of potassium exit from the cell, leading to calcium influx and release of insulin. So these are the steps. Finally, the answer to second question. Exercise induces glucokinase, thus it reduces the intracellular glucose concentration, facilitating more glucose entry inside the cell. So next question is for team C. Team C, get ready for your question. When it comes to the flavor of food, it is not just the taste that matter. There are various other types of sensory receptors which play a role. Question. Okay. So can you think of eating a liquid ice cream? Imagine you are served with a cold tea. Food flavor is also different when it is spicy. Similarly, smell plays important role. It is said that smell and taste operates in parallel. Without smell, onion tastes like apple. So here is your first question, Team C. There is a specific transduction mechanism which get activated when odorant bind to the receptor. The time starts. Odorant bind to dash protein, that is receptor, to stimulate dash enzyme to produce dash to cause dash effect. So you have to fill in the blank in this case in the given statement. So your time starts now. With a tricky question to answer.
Sir, for coordinate receptors, there are around 400 G protein couple receptors. So the first blend should be G protein receptor, which is also known as transducer. In the case of taste, it is gust reducer. To stimulate dash enzyme. So, sir, it will stimulate phospholipase C by acting by the GT pathway. To produce, sir, the calcium increase will lead to activation of calcium activated chloride channels. So chloride is in it's more in the sensory cells as compared to the accessory. So chloride will diffuse out, leading to depolarization. So the effect will be depolarization and now impulse generation. These were the things.
That's not the correct answer. Okay, so we'll move to the next question. Name the substance which can be smelled when even only 1/25th trillionth of gram is present in each ml of the air. Your time starts now.
So, I think the substance is ethyl mercaptan, which is added in LPG tanks so as to make the odor detector.
Yes, that's the correct answer. Very good. Well done, Team C. So the answer for the first question is odorant bind to G protein to stimulate adenyl cyclase enzyme to produce protein kinase A to cause opening of cation channel to increase the permeability of sodium and calcium. Okay. And yes, the answer for second question is methyl mercaptan. So well done, Team C. We'll move to Team B. Team B, are you prepared? Are you ready? So here is the question for Team B. So the fact is cytokines and colony stimulating factor acts through JAK-STAT pathway. There are 4 types of mammalian JAKs and 7 known STATs. So here is question number 1 for Team B. What are the steps which are occurring when ligand bind to these particular receptors involved in JAK-STAT pathway? The time starts now. The sequence is must at least first 3 steps after ligand binding.
So the Jack-Side pathway is basically because of the genus kinase. So as soon as the ligand will bind to the genus kinase receptor, because of the activity of genus kinase, there will be an increase in the amount of ATP. The ATP will, like in the case of insulin, it will increase the amount of number of ATP sensitive to calcium channels, which will in turn increase the calcium release and thus leading to.
That's not the correct answer. Okay. So shall we move to second question? So the second question for Team B is tell the full form of Jack stamp. Okay, you can force yourself, try to recall.
Janus kinase.
That is half answer. Try to complete it. Okay, time up now. Since the answer is partial, we will not permit any marks for the same. The answer is genus kinase, signal transducer and activator of transcription. Okay, so that is the full form of check. So no marks for team B. The next question is for team A. Team A, are you prepared? Are you ready? So the final question for team A. Nitric oxide is also known as endothelium derived relaxing factor, which relaxes vascular smooth muscle. Nitrous oxide acts on soluble guanylyl cyclase, which cause smooth muscle relaxation. So the first question for team A is here. Tell the enzyme responsible for formation of nitrous or nitric oxide and substrate from which it is formed in endothelial cell. Your time starts now. So team A, be in hurry. Your time is up. So no answer from team A.
So the substrate might be an amino acid or it is tyrosine.
So that's not the correct answer. So we'll go to second question. So the second question for team A is tell the ligand which act through membrane bound guanylyl cyclase.
Nitric oxide.
Sir, is that correct answer? That is not the correct answer. So no marks for team A. We'll see the answers. The question is membrane bound guanylyl cyclase and the ligand for this membrane bound guanylyl cyclase. The answer is the enzyme responsible for formation of nitric oxide and the substrate is nitric oxide synthase and the substrates are the amino acid argine, okay, from which we get the nitric oxide. And the answer to the second question is ANP, that is atrial natriuretic peptide. So no marks for team A again. So that's the end of signal transduction round. Over to Dr. Sunny.
So audience round for this also I will be taking in the end. Okay.
So the general rules for this rapid fire round is the maximum points is 50 points, 10 questions, 7 true or false types, 3 one word or oblique fill in the blanks type, 5 points for the correct answer. Here there is negative marking, that is -2 for incorrect answer. Past questions 0 points. Past question can be reattempted at the end if the time is left. Total time is 90 seconds, that is 1.5 minutes. You are supposed to answer loudly and clearly. Additionally, your partner can also mark answer in the sheet provided. And amongst you, you are supposed to say who's going to answer, and that person will only answer. Each person in the team, only one person will be answering. The other person can note down. You can pause any question or you can postpone any questions. If time permits, you can go back to the question. So you have 10 questions totally.
Okay, I will be telling to each team. See, 10 questions are there. I will be reading out. 7 है आपके true false और 3 है fill in the blanks too. Okay. So out of that, if correct answer you are giving 5 points and negative points if incorrect answer. For past question, it is 0 points. But one of partner will note ki which is past. So I can come to that question again. Okay. And anyone will answer. I think from you are going to answer. Okay. So here first will be 7 and other 3 will be fill in the blank. So I am waiting for your command. Voltage gated sodium channel is responsible for pre-potential phase in pacemaker potential. Incorrect. Hypoxia causes vasoconstriction in pulmonary circulation. Pass. False. Incorrect. Presence of X chromosome is must for female sex development. So 4. False. Correct. Beta cell are most common cell in the islet of pancreas. Correct. Osmolarity of CSF and plasma is same. False. Incorrect. Increased calcium level is associated with decreased excitability. So true. Correct. HbA2 has 2 alpha and 2 beta chain. Correct. See, when time up is coming there. Huh? अच्छा अच्छा ठीक. Okay, I will go to your time. So you just stand there. So just tell score. हाँ. So you can note down, okay? Team B ready? Who is going to answer? Should I read the rules again? Ready? So conduction rate in Purkinje's fiber is highest. Correct. Ventilation perfusion ratio is more at the base compared to apex. Correct. Erection of penis is controlled by sympathetic nervous system. Incorrect. Transient diabetes produced as a result of thyroid hormone is metathyroid diabetes. Correct. Lacinia corpuscle responds to high frequency vibration. Correct. Low base is a unit of excitability. Incorrect. Normal MCHC can be more than 38%. Correct. Urine become alkaline after the meal. This phenomenon is called. Correct. Total body water in person with weight 60 kg is. Correct. Name the type of musculature with the largest surface area. Wrong. Incorrect. Type of vasculature, capillaries. One of for passing, na, so you have to take a note of that. So nothing is to be written. Who is going to answer from your side? You. Fourth heart sound is produced due to ventricular filling in atrial diastole.
False.
Correct. Increased hydrogen ion concentration causes oxyhemoglobin dissociation curve to shift to left.
False.
Correct. Development of spermatozoa takes 70 to 75 days. Correct. Majority of non-diffusible calcium is bound to albumin. Correct. In dissociative sensory loss, there is a loss of touch and vibration sensation with sparing of pain and temperature. Incorrect. Q-tubule in cardiac muscle is dihydropyridine receptor.
Pass.
Gastric emptying is lowest where the meal rich in fat.
True.
Correct. Term homeostasis was given by.
Water cannon.
Correct. Part of kidney producing erythropoietin. Wrong. If increased conduction velocity is seen, then effect is positive. Increased conduction velocity. Effect is positive.
Chronotropic.
Correct. Ask question. Which number? Tell me. You have to make a note of that. I have told you initially only. In dissociative sense. Please make a note of past question. So who is going to answer? No need to read the rules again. So ready?
Start.
Direct control through autonomic pathway predominantly controls coronary blood flow.
Pass.
When vagi are cut, normal pattern of respiration will change to slow and deep.
True.
Correct. Cervical mucus is highly elastic during mid-cycle.
True.
Correct. Type 2B muscle fiber is having high glycolytic density.
True.
Correct. All writing reflex are integrated in medulla. All writing reflex are integrated in medulla.
False.
Correct. Length of muscle when cut from bone attachment is called equilibrium length.
False.
Incorrect. Unsaturated fatty acid increases the membrane fluidity.
True.
Correct. Any one area which lacks blood-brain barrier.
Cortical.
Correct. Salivary alpha amylase enzyme hydrolyzes which alpha linkase. Fill in the blanks. Correct. Dwarfism is as a result of unresponsive to growth hormone receptor. These findings. Correct. Last question. Direct control through the autonomic nervous system predominantly controls coronary blood flow.
False. Time up, sir.
Correct. False बोला था. So rules clear. So you are going to answer.
Start.
Prothrombin time is the measure of extrinsic pathway and common pathway.
True.
Correct. Peripheral chemoreceptors are stimulated by all types of hypoxia.
False.
Correct. Peristalsis will be observed even if there is no extrinsic innervation.
True.
Correct. Suprachiasmatic nuclei play a role in pineal gland secretion.
True.
Correct. Vestibulospinal tract controls skilled movement of the body. Pass. Positive feedback mechanism is always harmful.
False.
Correct. All actions of growth hormone and somatomedins are same.
False.
Correct. Trehalase enzyme in intestinal mucosa act on trehalose to form which end product?
Pass.
Predominant hormone released by zona glomerulosa is correct. Main limiting factor to achieve VO2 max is vestibulospinal tract controls skilled movement of the body.
False.
Correct. trehalase enzyme in the intestine mucosa acts on trehalose to form this end product. Main limiting factor to achieve VO2 max is so scorer is just making the calculation. So I will go to audience till that time. So audience ready? But before, so इनको दे दी he will be called और इनको भी दे दो. Audience, please join fast. चालू है. So now I am starting. Start. So it is knee heel test. It is not coming picture, but it is knee heel test. Diagnosed case of megaloblastic anemia started with B12 therapy. What will happen to reticulocyte count on day 3? There are only 3 options. It is 3rd day. It is not 8th or 9th day. So no change. सर ये साइड में करना है क्या? Okay, so I would request Dr. Avinash to felicitate our quiz winner of the audience round, Mohit. Audience, please join. I'm giving you 1 minute. वहाँ का टोटल लिख दीजिए। फोटो में ये आएगा तो मैं ये प्रोजेक्ट नहीं कर रहा हूँ अभी यहाँ। Vedant coming everywhere. Okay, I'm starting now. अरे उनके मोबाइल पे जाता है ऑप्शन। क्वेश्चन 2 बी रेडी। बार कैडी कौन है? So last question, last medal for audience. Prince has come into the picture. Bar caddy is third. Shiva and Rishi. Hey, who is Veda? Okay, I would request Dr. Sunil sir to please felicitate Vedant number 2.
क्योंकि मुझे तो ठीक है, आप लोग अपने हिसाब से
So, how many of you know something about One Day World Cup, Cricket World Cup? See, sixth World Cup was the World Cup where, for the first time, host went on to win the World Cup. It was 1996. It was hosted by India, Pakistan, Sri Lanka, and that World Cup was won by Sri Lanka, which was one of the hosts. So, this is one of the coincidence that this is the sixth. Our sixth is there, and for the first time, we are the winners. I have never played. Cyclist was long with the second question. Other places.
Let's give a warm welcome to our chief guest, Professor Dr. Ajay Singh sir, Executive Director, AIMS Bhopal. The generously accepted our invitation. Would love to have you, sir. I request Lecturer sir to give a warm welcome to our director, sir. Yes, Ravi ma'am. Give a warm welcome to our officiating medical superintendent, sir, Professor Shashank Kumar, sir. I now request our chief guest, Mr. Dr. Ajay Singh sir, to address our participants and the audience.
Thank you very much. I think we have announced the winner. is going, everything is there. It is already announced that team Gopal B is 148 and Gopal C is 121, followed by B. Is for the 84. So I think already congratulations to everyone, all the participants all the participants who have participated. A big congratulations to everyone. And moreover, winners must have done something extra than others participants. So congratulations to them also and the institution uh, to which they belong and the teachers of these students should also be acknowledged. And I'm sure uh, whether winning or not winning is not so important, rather than participating is more important. So we have participated, and that should be acknowledged. And I request that everybody who has participated must get some certificate. They will get the certificate that they have participated, and I think best wishes from my side. And
request all of the faculty of Department of Physiology to join the matrix on the dais. I now request our chief guest to felicitate our winners and runner of the sixth edition of National Undergraduate Physiology Quiz Program. I request the faculty to join the matrix on the dais. So we start with the fifth place, that is GMCH Chandigarh. Argunbir Saini and Manmeet Singh. Yes. Who's next candidate? Question goes to Team E, Ames Library, Garvit Gupta and Ritika Malik. Third position goes to Mahatma Vidur, Autonomous State Medical College, Mantyagi, Radhika Singh. Question and first question is backed by the Ames Bhopal. Second question goes to Fancy, Raja Katri and Vedant Limited. First question is Team B, James Bhopal, Anand Khatri, and Nayan Pandey. Request all the team members to come forward, or the participants to come forward on the desk for a photograph of all the teams. Winner of the audience round also can be. Winners of the audience round can also be.
Their medals, please now. Their medals, please. Quickly. India.
Sir, Dr. Sandeep sir, to convey the vote of thanks.
Respected faculty members, students, finally we have come to the end of event. Before delivering of vote of thanks, I would like to narrate the journey of this particular event so far. So this quiz has been started way back in 2019. Now sixth edition is over. We had been undergoing through the modification in each year. First event was purely physical event, but with the COVID pandemic, immediate event in 2020 was cancelled. Second event in 2020 was purely online event. With COVID pandemic over, we again shifted to offline. But during feedback, we found that traveling just for cleaning around is compulsory for first year student. So since last 3 years, all screening rounds are shifted to online mode and main event is conducted in physical mode. During our journey, we also published a paper entitled Innovative Approach of Learning Physiology through National Level Quiz, which was a questionnaire based study based on feedback of students. So this was our journey, but in future I'm not sure whether this activity is going to continue or not because I have been noticed continuous decline in the interest part of students. So I am highly privileged to give vote of thanks. I would like to thank our executive director, sir, Professor Dr. Ajay Singh, who always motivates us to conduct such activity. Dean Academics, Professor Dr. Rajnish Joshi, and his whole office support us in all possible way. Also like to extend my gratitude to Deputy Director Administration, Colonel Dr. Ajit Kumar, who is always ready to help us. My heartfelt thanks to Medical Superintendent Professor Dr. Shashank Kumar, who is again he has accepted our invitation and we have joined for the event. All questions were peer reviewed by my colleague and senior faculty member. Thanks to our HOD sir, Professor Dr. Silpa Shah sir, Dr. Rajni Bharshankar sir, and whole team of faculty members because there are many mistakes which has to be taught in time, and this is done only because of peer review. Support staff have done their best in all possible way. All support staff, thanks. Our JR Shashidharan, Vikas, Foran, one IT staff, all our staff, technician, all project staff were helping, and faculty has accepted our invitation. So I must thank you them. So here participants were the heart of events. Thanks to all 35 teams and qualifier teams, especially Chandigarh team, AIMS, Raebareli team, and Mahatma Vidur Autonomous Institute, Vijay, UP. They have they have traveled all the way from their places. So audience were present, though audience was less. All you were present throughout the event. So I hope it was fruitful for you. Those who are not those who are not attended has missed a lot of, you can say, lot of knowledge. So in the end, I would like to quote a famous saying by Sir William Osler, a Canadian physician. To study the phenomenon of disease without books is to sail an uncharted sea, while to study books without patient is not to go to sea at all. I am repeating, to study the phenomenon of disease without books is to sail an uncharted sea, while to study books without patient is not to go to sea at all. So with this, I declare this event is ending here, and you can join us for the cup of tea with the samosas. Thank you.